some of these stats are pretty shocking, right? Non-optimized medication use in the US is about 528 billion, about 16% of our healthcare expenditures.
A lot of times they're looking at their expenditures as it relates to their health plan in sort of two buckets. They look at the medical bucket and they look at the pharmacy bucket. And I think the challenge is that there's no two silos. It's really connected. So I think one of the challenges is looking at their expenditure as one situation. A lot of times we're talking about reducing pharmacy costs because we talk a lot about the rising cost of prescription medications. One of the challenges with that is that if you're taking your medications and you're getting the outcomes that you expect to get from those medications, that investment in that medication is doing what we need it to do to help reduce the cost on the medical side.
Prescribe something, we go to the pharmacist, they don't disclose any side effects, we just sign on the electric thing, get our prescription, go home, don't ask any questions, don't ever talk to anyone later on. And that's, and then you add multiple drugs where there could be interactions or problems or outcomes. It's like, there's this complexity of like, what's wrong with the system?
I think the challenge we have in terms of our traditional view of pharmacists is that most of us think about the pharmacist as only ensuring that they're dispensing the right medication to you. So they're giving you the right medication. And that's one huge and incredibly important component, is this the right medication that's going into your bottle and getting delivered to you? So the commercial retail pharmacist. But the reality is that what everybody really needs is the opportunity to work with a pharmacist to have a comprehensive review of not only the prescriptions that are being prescribed, but in the United States, we're taking more and more supplements and vitamins than we ever have. And at the end of the day, the complexity of adding to an average person taking 10 medications, with 6 of them being prescription and 3 of them being over the counter, being able to understand how those medications work, what their intention is, what are their side effects, and what goals should you expect to get out of it, is what a clinical pharmacist is designed, or in clinical pharmacist focus is to ensure that you have a good understanding of your disease states, your medications, and the non-pharmacological things that you need to do to ensure you're achieving the outcome. So it's kind of helping create this map of where you're going with on ensuring that we are protecting the investment that the employers are putting into their health plan by ensuring that the membership that's on their health plan that has chronic conditions and multiple medications, they're getting the outcomes they expect from those medications related to the chronic diseases, so that we're protecting the investment and reducing the high cost channel utilization on the medical side. Your diabetic whose blood sugars are controlled is not going to go into the ER as frequently as the person who may not understand how their medications work. So that, to me, is sort of the complexity that we're dealing with and what we can offer as a clinical pharmacist to the healthcare team to ensure that we're achieving the best outcomes.
The major differences that we see in Tria versus some of the other programs out there is a lot of the programs that are out there to manage complex conditions are very, what I would refer to as transactional. Meaning you didn't pick up your medication, you get a text message that says, pick up your medication, or they identify a gap in care and you get an email or something like that. The Tria approach is much different, where it's one-on-one time with that member and a clinical pharmacist to really kind of talk about, their condition and what they're experiencing and kind of overall things around their lifestyle. So it goes far more in depth than what you would see in some of the other kind of traditional programs.
Because medications cause problems, they can solve problems, but to Jessica's point, they can also cause problems. And I love that idea that it's getting more attention, we're paying more attention to it. We need to be doing more of these kinds of in-depth observations of the data, analyses of the data, and then translating that into actions for our employees. It's not about the medication costs for hypertension. That's a minimal piece of it. It's preventing the heart attack, preventing the stroke, for example, the disease in the kidney.
When has the doctor ever picked up the phone and called you to ask you, how's that medication doing? Has anyone ever had their doctor follow up with them once they've prescribed them the medication to see how it's doing or you're improving or anything?
PharmDs have extensive experience. We're the medication experts. We're the doctors of medicine. So the opportunity that we can bring to a care team with a physician and a patient is the expertise of how medications work, or what the newest line of medications can do in terms of aligning with that particular individual's goals of where they're trying to go for their disease state. There's a problem in the United States, and pharmacists are able to drive the understanding of not only how diseases work, but how the medications and the non-pharmacological things that they do help them to get where they need to be. Expertise in diagnosing, and that the pharmacist can bring the value of understanding how that medication works in that arena to the member. That whole personalized medicine conversation is, we're at the cusp of pharmacogenetics and where that goes for individuals, and mental health is a huge arena where we can ensure that people are getting the right medication prescribed for them to drive the best outcomes.
Is that people react differently to different SSRIs, and there's a pharmacogenome, there's a pharmacology inside of you, or a genetic makeup that determines how you're going to react to those medications. So pharmacogenomics is extremely important to make sure people get on the right medication, the right dosage, the right strength, and all that kind of stuff. And I think getting that medication right is really key and takes a little bit, and having somebody linked in to help manage that condition.